Yeah, so I think many interventionalists, surgeons and invasive cardiologists are getting, they would argue, and I think reasonably, that they're getting better and better at doing these procedures. So in each discipline, surgeons and interventionalists have a tool, a growing sense of toolbox where they are very sophisticated. But I think one of the issues that we're reaching in cardiology, but also other aspects of medicine, is that patients may get through the procedures, they may get through cardiac surgery better and better, or have, one of the examples is the new valve put in through a catheter, transcatheter aortic valve replacement. But patients may not really they might survive more, but they don't always actually get better. And so this is the question. We not only have to deal with the short-term benefit of a procedure, which I think the interventionists will argue they can respond to aging, they can respond to frailty, but I think we have to think about the long-term effects. So one of the things that I'm interested in personally is cardiac rehabilitation, which I would argue is a very good thing for older people, but it tends to be massively underused by older people because it has logistic impediments and all kinds of other aspects. And certain kinds of heart disease aren't reimbursed for heart failure, for cardiac rehab. And I would think there may have to be different thresholds for older patients, because given their frailties and their other impairments, they might benefit disproportionately if we figure out how to provide access. One issue that is, quite dramatic almost with every patient is that there's often a discrepancy between the goals of the family members and the goals of the patient. So I think one of the things which, it's easier said than done. I mean, it kind of makes sense intuitively. You should listen to your patient. Patient-centered care, start with your patients. But that's really often complicated by a son or a daughter who has a very specific vision of what he or she thinks is best based upon something they've read or they believe. And it often has a projection of their own anxieties about their own aging. So it's very complicated stuff. And I feel like it's not something which, a busy clinician can easily process, especially if it's an acute episode of instability. Somebody has an MI, a heart attack, and they're in the emergency room. You're making decisions lightning fast, and the patient, who might be older and frail, may be confused, maybe just frightened, and so I feel like the family often kind of becomes a dominating voice. So these things become really problematic. I think that is part of the challenge, is not only developing medical expertise, but developing a language and a process of thinking about the caregiver. The other point to really emphasize when you talk about caregivers is that most older adults have, a caregiver that's burdened. Most older adults with disease have a caregiver that's burdened with taking care of them. So that could be the very well-meaning son or daughter, or it could be a spouse that may be infirm to his or herself. So another element of care that I think is appreciated, but I think it could probably be done even better, is improving care for the person, improving the management or support for the caregiver to the patient. And there's many studies that show that the caregiver, his or herself, is prone to more episodes of disease. It's very stressful. It diminishes their quality of life. And in the midst of budgetary crises and all these cutbacks that we're all struggling with, that's one of the areas where support is often jeopardized. It is a challenging time. So I think that in terms of what the government and Medicare wants to pay for is not so easily done. I think many insurance companies are now looking at this because it actually does lead to the potential of cost savings if they get this right. And so there is a pretty aggressive thought process to try to improve care. Again, looking at the systems of care, looking at the patient as an aggregate of multiple diseases, and looking at the process of care as being an aggregate of multiple providers, and trying to enhance the discharge so that patients have better monitoring, better feedback, better supports for families. And so it is happening. It's happening system by system in individual ways, but there's no general standard yet.